Welcome back, everyone. You've actually made it to part 6. This is our special bonus explainer. Today, we are taking a super high-energy deep dive into specialty-specific coding rules. And, well, we're giving you the ultimate master checklist for modifier success. Seriously, if you want to stop leaving money on the table, you are in exactly the right place. But hey, before we get into today's playbook, I need you to do one quick thing for me. Make sure to like, share, and subscribe to Decode Healthcare with Harshal. It really helps us keep bringing you these deep dives, and it helps the whole community master these complex guidelines.
All right, let's look at modifier usage by specialty.
So, we're transitioning right into a rapid-fire masterclass here. Why? Because modifier rules, they shift drastically depending on your specific clinical setting. What works perfectly in a primary care clinic? Yeah, that'll get your claim instantly denied in the operating room. Let's look at office visits and primary care. Your heavy hitters here are 25, 59, XE, XS, and 76. For example, imagine a patient comes in for a routine checkup, but actually you also end up treating a new severe ankle sprain. That is exactly where you rely heavily on Modifier 25 for a significant, separately identifiable evaluation and management service. Your documentation here just has to be bulletproof. And hey, don't forget Modifier 76. It's absolutely crucial for same-day repeat diagnostic tests. Think of a repeat glucose check when you're monitoring a patient's response. Now let's see how this builds in surgery. The sheer volume of modifiers available here is literally massive, mostly because surgical coding hinges heavily on global periods. You're going to lean on Modifier 78 for an unplanned return to the operating room to handle a related complication. And you'll use Modifier 57 when an EM service leads to the initial decision for a major surgery. Imagine evaluating a patient for severe abdominal pain and deciding right then and there to remove their appendix. Perfect use case for 57. You're also dealing with bilateral procedures using 50 and multiple procedures using 51. Trust me, the operative notes are absolutely your best friend here. Moving on, radiology has a completely different flavor. Here, you're frequently splitting claims into two distinct parts. It's almost like a giant puzzle. You have Modifier 26 for the professional component. That's the physician's interpretation and written report. Then you have the TC modifier for the facility's technical component, covering the physical equipment and the staff. Think of it like paying to rent the X-ray machine versus paying the doctor to actually read the image. Getting the split wrong? It's a massive and, frankly, totally avoidable source of denials. Next up is durable medical equipment, or DME. So DME billing requires strict anatomical modifiers, like LT for left and RT for right. But beyond anatomy, you also absolutely need condition-met modifiers like KX. This specific modifier proves to the payer that strictly defined medical necessity requirements have been met and that they're thoroughly documented in the patient's record. Without that KX modifier, payers will simply assume medical necessity wasn't met, and boom, that equipment cost comes right out of your bottom line. No way around it. Over in the emergency department, the pace is fast and so is the coding. ED coders really must master Modifier XC for separate encounters on the exact same day, like when a patient is discharged but comes back hours later with a completely new issue. And for things like serial testing, think checking cardiac enzymes multiple times throughout a single patient's stay, you're going to need Modifiers 76 and 77. That prevents those subsequent tests from being incorrectly bundled and just flat-out denied as duplicates.
Let's dive into pre-submission review and best practices.
Knowing the codes is really only half the battle. Now we need to look at macro-level workflow strategies that guarantee clean claims before they even hit the clearinghouse. And remember, the clearinghouse is essentially the digital middleman that formats your claims before they reach the insurance payer. First up, claim scrubbing. You must use software to check your claims against NCCI edits. Those are the National Correct Coding Initiative rules. This catches bundling issues early. Second is manual documentation review for high-risk modifiers. You have to ensure the medical record actually supports the code. Third is benchmark comparison, meaning you compare your practice's modifier usage rates to national specialty averages. And fourth, denial trending. This is what helps catch systemic errors before they completely wreck your review cycle.
Okay, here it is, the master checklist.
This is the moment you've been waiting for. I highly recommend you grab a screenshot of this 10-point modifier selection checklist and actually use it daily. It is literally your ultimate cheat sheet to ensure compliance and maximize reimbursement. So, before you hit submit, ask yourself these critical questions. Is a modifier actually necessary? Have NCCI edits been checked? Does the diagnosis code support medical necessity? Are the modifiers in the correct order per pair rules? And most importantly, have you selected a specific X modifier? I'm talking XE, XS, XP, or XU, instead of just defaulting to the highly audited generic modifier 59. Running through this list is, hands down, your absolute best defense against audits and rejections. So I really want to hear from you. What is your biggest modifier challenge? Seriously, drop your most frustrating specialty-specific denial or coding challenge in the comments below. We absolutely love reading through these and solving them together as a community. And that wraps up our complete explainer series on modifiers. Keep applying these strategies, keep your documentation spotless, and keep decoding healthcare. Ask yourself this week, just how much revenue is your practice losing to simple modifier mistakes? It's time to find out. And once again, make sure to like, share, and subscribe to Decode Healthcare with Harshal. See you next time.